Good afternoon, everyone. I'd like to welcome you to the webinar today on addressing discrimination and stigma in youth suicide prevention. My name is Brandon Stratford, and I'm one of the presenters for today. I'm the Deputy Director of Education Research at Child Trends and a former clinical social worker. I'm joined by my colleague, Fadumo Abdi, who works in the Youth Development Program area here at Child Trends as a Senior Research Analyst. I'm also joined by Dr. Maisha Price, who's a Senior Research Scientist at the Trevor Project, the world's largest suicide prevention and crisis intervention organization for lesbian, gay, bisexual, transgender, queer, and questioning young people. She's a developmental psychologist with over 15 years of experience in adolescent public health research, with a focus on sexuality, gender, and LGBTQ youth from an intersectional and developmental perspective. This webinar is supported by a cooperative agreement with the Centers for Disease Control and Prevention's Division of Adolescent and School Health, and the views expressed do not necessarily represent the official views or endorsement of the CDC. The webinar today is what I like to call a LEAHP and Friends webinar, which means some of you know about the LEAHP project, but some of you might not. So I'll just give a quick overview for our friends. With funding from the CDC's Division of Adolescent and School Health, the National Coalition of STD Directors, Child Trends, and the National Association of State Boards of Education launched the Leadership Exchange for Adolescent Health Promotion to help state health and education agencies work together to advance adolescent health, with a focus on sexual health education, sexual health services, and safe and supportive environments. You can see the goals of the project here, and the map shows which states have LEAHP teams. On the bottom right, you can see our webpage, which has more information about the project. I'll just note quickly that while LEAHP emphasizes sexual health education, sexual health services, and safe and supportive environments as ways that schools can promote adolescent health, today we'll be focusing mostly on the safe and supportive environments aspects. If you have any questions about LEAHP, please feel free to pop them into the chat. So, as I mentioned, we'll be focusing mostly on creating safe and supportive environments in schools today as a way to reduce youth suicide. Specifically, after the webinar today, you should be able to describe trends in suicide deaths and attempts for different groups of youth, explain the role of discrimination and stigma in suicide risk, and identify strategies to foster school connectedness that reduce suicide risk. So, at the big picture level, this webinar is all about connecting the dots between suicide disparities, experiences of discrimination, and safe and supportive schools. We'll be focusing a lot on lesbian, gay, bisexual, transgender, queer, and questioning youth, or LGBTQ youth, but we will also share some data on race, ethnicity, and disability status, because just like all of us, LGBTQ youth hold many identities, and it's important to be familiar with the data related to other marginalized identities that LGBTQ youth might hold. To get us started, my colleague Fadumo will review some of the data with respect to suicide disparities.
According to data from the CDC's National Vital Statistics System, suicide is among the leading causes of death for youth. For adolescents ages 10 to 14, it's the second leading cause and the third among those 15 to 19 after accidents and homicide. Risk factors among youth include history of family suicide, mental health problems, incarceration, substance abuse, suicidal behavior among peers and friends, as well as other ACEs factors. As we'll see, rates vary by gender, sexual orientation, race, and disability. The variation is in great part due to the systemic experiences of discrimination such as ableism, racism, homophobia, transphobia, and for some youth, the intersection of these discriminations. You can see in this graph that the rate of suicide deaths was on the rise until 2017 when it dipped slightly. While it is good news to see a reverse in the trend, it's also important to take a closer look so that we better understand what that dip means for youth suicide prevention efforts. Finally, if you look at the bottom, you can see that the data were pulled from the CDC web-based injury statistics query and reporting system, or WHISKERS. If you are interested, you can take a look at the data for your state. Overall, in 2017, the rate of suicide peaked following an increase by 57% since 2007. According to the CDC 2019 YRBS data, 1 in 11 high school students had made a suicide attempt, while 1 in 5 students have considered suicide. While this line graph shows a decline in the overall rate since 2017, a closer examination across youth identities shows that not all groups experience this decline. First, let's take a look at the data by race and ethnicity. You can probably notice right away that American Indian youth have a much higher rate of suicide than all other groups. In fact, in 2020, the rate of suicide deaths for American Indian youth between the ages of 15 and 19 was at least triple the rate that of any other group. Next, if you pay attention to the numbers and arrows on the far right side of the graph, you might notice that American Indian youth also had the largest increase in rate of suicide deaths between 2017 and 2020, while white youth are the only group for which there was a large decline. This large decline is in line with the overall trend we saw on the last slide. We can also note that while Hispanic youth increased a drop, it's much smaller than their white counterparts. Asian and Black youth experienced a similar rate increase. Now, if you are familiar with data related to suicide deaths and gender, you probably already know that males have a much higher rate of death by suicide than females. We'll take a look at those data on the next slide. Here, you can see that the rate of death by suicide has consistently been higher among males than females. If we look at 2020, the rate for males is about 3 times as high as the rate for females. However, if you pay attention to the slope of the orange line that represents females, you'll see that it barely changes. However, the purple line representing males has been dipping, which is in line with the overall pattern, again, that we saw earlier. One other thing to note here is that there is a big question mark towards the top because we only have national suicide deaths for males and females, but we do not have national data for transgender youth. When we move on to looking at suicide data, we will see why that lack of data is a concern. Now we'll switch to looking at data on youth suicide attempts. These data all come from the CDC's Youth Risk Behavior Surveillance Systems, often referred to as the YRBS. Just like the Whiskers data, there's a data dashboard that you can use to examine the data in your state. You can also look at the data for a number of large metropolitan areas as well. I want to draw your attention to 2 lines in particular. First is the purple line, which represents American Indian youth. We don't have data points for 2013 and 2017 because the number of American Indian youth that participated in the survey those years was too small to get reliable estimates. However, you can see that for 2019, which is the most recent data for the YRBS, the percentage of American Indian youth that reported attempting suicide in the previous 12 months was at least double the percentage for any other group. For the rest of the groups, we do have data for each year, and you can see that most of them follow a similar pattern of a dip between 2015 and 2017, and then an increase in 2019. However, if you focus on the teal line, which represents Black youth, you'll see that the percentage of Black youth reporting a suicide attempt has been steadily increasing. Now, let's move on and take a look at suicide attempts based on sexual orientation. On this slide, the orange line represents lesbian, gay, and bisexual youth. Transgender youth are not included here for 2 reasons. First, we don't have the data. While some jurisdictions have begun asking about transgender identity, those data are not widely collected. We'll take a look at the data that has been collected on the next slide. But the other reason transgender youth are not included is because it's a gender identity and not a sexual orientation. So you can see here that there has been some good news with a dip in the percentage of LGBT youth that reported a suicide attempt in the past 12 months between 2015 and 2017. As we can see here, suicide attempts among LGBT youth has been declining since 2015, beginning to narrow the gap between straight and LGBT youth. Still, LGBT youth are 4 times more likely to attempt suicide. The percentage for straight youth did not change nationwide. On the next slide, we'll take a look at the data for transgender youth. So in 2017, a question about transgender identity was piloted, and those data represent one of the larger sources of data allowing us to make comparisons between cisgender and transgender youth. You can see here that females were more likely to report a suicide attempt than males, which is a reverse in the suicide rates where males are more likely to die by suicide than females. Now, if you look at the bar to the far right, you'll see that transgender youth are much more likely to report a suicide attempt than their cisgender peers. In fact, they are 3 times more likely to report a suicide attempt than cisgender females and 5 times more likely than cisgender males. We'll hear more about the experiences of transgender youth when Dr. Price presents some of the national survey data that has been collected and analyzed by the Trevor project. The last group that we will look at today is youth with disabilities. Similar to transgender youth, we don't have nearly enough data on the experiences of youth with disabilities. However, the data that are on this slide come from a population sample of youth in a county in Wisconsin. That is important because it means that we are able to make comparisons between youth with disabilities and youth without disabilities that are more of an apples-to-apples comparison than studies that might only collect data from youth with disabilities. You can see that what the researchers found is youth that reported multiple disabilities were almost 8 times as likely to report a suicide attempt compared to youth that reported no disabilities. Youth that reported one type of disability were 3 times more likely to report a suicide attempt compared to their peers than those that reported no disability. It's important to note that this is only one study that took place in a single county in Wisconsin. While it aligns with some other studies about the risk of suicide among youth with disabilities, a lot more attention needs to be paid to the experiences of youth with disabilities. Now, I'll pass it over to Dr. Price to share some more about the role of discrimination in suicide risk.
All right, so before I talk about specifically what's on this slide, I do want to talk a little bit about the data because I realized I didn't give a lot of context for that. Just to compare to what was just discussed, our data covers LGBTQ specifically. We don't have anyone who is who identifies as just cisgender and straight in our sample, and it covers the range of 13 to 24. So that is a little bit more older than what you see in the data that's collected by the YRBS. So when we do have comparisons when we compare our data to the age range that's collected in the YRBS, we have similar rates of attempting and considering suicide. And we've done this data collection yearly since 2019, and you can see what you can go to our website and see the latest findings from our, what year are we in now? What year is this? From our 2021 national survey, and you can see the YRBS comparisons there, but you can also see the rates of considering an attempted suicide for this specific sample if you want to see that. I'm not presenting that here because I thought it was a nice job was presented already. You can already see the disparities that are there, but what I am going to talk about is what we see from the specific impact of how these youth are treated, how LGBTQ youth are treated, and how that can impact some of the rates of suicide that we see in this group. So we already know that the higher rates of suicide risk for LGBTQ people is from increased internalized stigma, discrimination, and rejection from others. So this data right here that you're looking at discriminates the association between discrimination and mental health for LGBTQ youth. So 60% of the LGBTQ youth in our sample experienced discrimination based on their sexual orientation or gender identity. And for those who reported it, who reported this discrimination, reported almost 3 times the rate of suicide attempt compared to those who did not experience this form of discrimination. You can also see in the top that there's a finding for specific to bathroom discrimination for transgender and non-binary youth, and that suggests the importance of providing gender neutral bathrooms for youth. And gender neutral bathrooms are not just important for transgender and non-binary youth, because it's the stressor built into their everyday lives when you have to, sort of figure out where you're going to go to the bathroom, and that you might experience victimization in the bathroom and discrimination. But it's also just a signal to everyone that this is a supportive environment, no matter who you are. So next slide. So this is when we start to look at specific forms of discrimination. You can see that LGBTQ youth who experience discrimination on the basis of their sexual orientation, that's that first one, their gender identity, and their race, ethnicity, or nationality, all report twice the rate of attempted suicide in the past year. However, while these findings are important in and of themselves, you can see that increase based on each of those. We know that so many youth, and probably some of you right here listening to this call, don't hold just one of those identities, right? And separating them out like that just doesn't really exist in the lived experiences that people and youth hold. And often, youth experience all of these forms of discrimination, or more than one at least. And so if we go to the next slide, you can see what this looks like when youth are experiencing more of these forms of discrimination, how that increases their risk for suicide. So more than 5 times as many LGBTQ youth who reported experiencing all three of these forms of discrimination attempted suicide in the past year, compared to 7% who had not experienced any forms of this discrimination. And importantly, this particular data that you're looking at right here was collected in 2020. So this was actually in the context of anti-Asian increases in anti-Asian violence and the Black Lives Matter protests that we were experiencing in that time period. And I also want to point out that 2 out of 3 Black LGBTQ youth reported experiencing race-based discrimination, and 3 in 5 AAPI LGBTQ youth also reported that, which further suggests that there are unique experiences that LGBTQ youth of color experience and that need to be addressed when we're thinking about how we can sort of impact the increased rates of LGBTQ youth, this in the sense that like one size fits all isn't really going to work for these youth. So we can go on to the next slide. And this particular slide gives a more specific look or example of what it looks like to hold multiple marginalized identities for some of these youth. This is specifically looking at Black LGBTQ youth and how holding multiple marginalized identities for Black LGBTQ youth puts them at risk for experiencing discrimination and victimization based on several identities. It's including, but definitely not limited to, race, ethnicity, gender identity, sexual orientation. And so in the sample specifically, more than half of Black LGBTQ youth reported discrimination based on race and ethnicity in the past 12 months. And then you have another 46%, well, probably there's overlap there, right? So 46% of Black transgender and non-binary youth reported past year discrimination based on their gender identity. Among all Black LGBTQ youth, 41% reported discrimination based on their sexual orientation in the past 12 months. This discrimination and the sort of compounding of it, so it's not necessarily additive. You can't say like, well, if you just add them together, but the sort of like mixing them all up and the impact of all that is obviously associated with increased risk for suicide. This pattern is the same for any subgroups in our sample. So we're finding that anytime you have these multiple marginalized identities, it's going to place youth at an increased risk for experiencing discrimination and victimization based on these identities. We have a forthcoming report on AAPI LGBTQ youth. We're seeing the same thing. We're seeing increases in immigration status discrimination, for example, which is higher than what we're seeing on this slide, for example, but also race, ethnicity-based discrimination. All these other things are also happening to them. We also have a report coming out at the end of the month on deaf or hard of hearing LGBTQ youth. Essentially, the overall message, and in that group, you see discrimination within the deaf community for being LGBTQ, then you see discrimination within the LGBTQ community, actually discrimination and lack of access, so they're not able to necessarily gain supporting these groups because they don't have signing happening at events, and they're not able to get the support that they can get in these spaces. So the overall message is that they can experience discrimination and exclusion from the larger communities that they, identities that they hold, but also from within the LGBTQ communities. So next slide. So these findings are specific to transgender and non-binary youth. And I just want to point out that transgender and non-binary youth report the highest rates of suicide attempts in our sample. And this is across every time I run any analysis within each subgroup, it's always higher for transgender and non-binary youth. However, you can see that this is a start finding, and it's sometimes difficult to look at, but we can see that this is the impact of how youth are being treated. And we can see once we remove this sort of negative societal treatment, what it can do for these youth. And so if you look at the bar graph in the middle right here, you can see that transgender and non-binary youth who have their pronouns respected by all, or most people in their life, report suicide attempts at half the rate of those whose pronouns were not respected. Whose pronouns were respected by none of the people in their lives. And you just see this gradual decrease. This is one of my favorite charts. Like, you see this gradual decrease in suicide rates with more people who are respecting their pronouns. They're reporting lower rates of suicide attempts. So that's just so important to youth. It's something that we can do as part of our everyday lives for youth, is to just, use the pronouns they want us to use for them. And so if we move on, I just want to briefly touch on physical threat and harm before going into some additional findings on the cumulative impact of minority stress, just to show that 1 in 3 LGBTQ youth reported having been physically threatened or harmed due to their sexual orientation or gender identity. And LGBTQ youth who reported having experienced this had 3 times the rate of suicide attempts in the past year. And I wanted to show this because it's one of our, while not as many youth report this as something like discrimination or something that is sort of like an everyday experience, it is one of the most impactful things that happens to youth. And I think this is important because it shows, again, youth, the relationship between being mistreated, being harmed in your, because of an identity you hold, and that relationship to suicide. This is a little bit, I'm gonna walk you through this. There's a lot of, just charts here. These findings are from our manuscript on cumulative minority stress and risk, and I thought it was very relevant to this talk here. So we made some graphs to illustrate the findings here. And so we measured youth experiences with housing instability, perceived discrimination due to their LGBTQ identity. So just, discrimination due to LGBTQ identity, physical harm or threat, which I just talked about, and attempts by a parent or caregiver to convince them to change their sexual orientation or gender identity. That's a new one that I haven't talked about yet. And that's just sort of like a parent or caregiver just being like, something subtle as like, are you sure maybe you shouldn't be gay, or something, or it can range all the way to conversion therapy. So this is a wide range of like a parent or caregiver not supporting who they are, what their identity is. And we didn't actually specify with this question what it could be, but either way, it's a signal from a parent or caregiver that they're not affirming their identity. So this top graph shows the percentage of LGBTQ youth across race, ethnicity who reported none of these factors. So that's the 0 risk, none of these risk factors, none of the 4 I just mentioned. And then you can see also the percentage who reported all 4 of those. The 1, 2, and 3 are out because that's way too much data and also not really that important for what I'm presenting here. But you can see that just to sort of walk you through a little bit, you can see if we look at American Indian, Alaska Native, 22% reported not having experienced any of them, whereas 8% reported all 4 of those risks. The corresponding lower graph right here shows you the suicide attempts for those different subgroups of race, ethnicity, LGBTQ youth across race, ethnicity. I want to, again, all these youth are LGBTQ, and this is across race, ethnicity. So essentially the overall finding is that you can see that the higher their rates of experiencing all four risks, you can see increases in their suicide rates in the past year. And so this is the same finding for gender identity, and you can see the same pattern here. And the stark difference here, and I like to point out again, this is all LGBTQ youth. So everyone on this, in this sample here, this is comparing transgender girls, transgender boys, non-binary youth to cisgender LGB youth. And I think some people are kind of on the side of that because yes, transgender non-binary youth are at higher risk, even compared to their LGBTQ peers. And that's one of the things this slide is pointing out, but it's also illustrating, again, that relationship with more of these risks accumulating into more higher rates of suicide in the past year. Okay, so now I'm going to turn it over to Brandon, who's going to talk more about how states do and don't talk about discrimination and stigma in their suicide prevention plans.
Okay, well, thanks. Hopefully all these data are useful and helpful to hear. I know it's a lot, and I know sometimes when I attend presentations like this, oops, sorry. Lost my connection.
Brandon, we can still hear you and see you.
Okay. So I cannot see the presentation, so I'm going to need to work on that for a moment, but I will just say that what we're going to talk about next, and I'm going to actually turn it over to my colleague anyway, Fadumo, to get started talking about this, is that we took a look at states' suicide prevention plans to see how they are addressing exactly these issues that we're talking about right now. So we wanted to see, are they talking about the disparities by different groups? Are they naming them? And beyond, are they naming them? We also wanted to know, are they making linkages between the disparities that exist and experiences of discrimination and stigma? Because I think a lot of times what we see is people just kind of put out these disparities and don't make it clear that it's not just that these groups are extra vulnerable and just need, us to help them get to the help they need, but that we really need to make it clear that there are reasons related to discrimination and stigma that many of these groups that have these higher risk are experiencing that risk, and that it needs to be addressed. So while I figure out my screen situation, I am going to turn it over to Fadumo to go over some of the examples from the state plans that she helped us to review.
Thank you. And that hopefully that gets resolved quickly for you since you're leading us. To the next slide, please. So before sharing the examples and going into a bit more detail, I wanted to note that when we looked over state plans to determine whether or not a state just identified a disparity versus a discrimination, or whether it addressed it in their plans, like its strategies, we identified that a state only got to the level of disparity if they just shared, for example, data that's disaggregated by any of the identities we discussed today, or it just, just like has like graphs or bars just showing experiences of people like with different identities. However, we noted discrimination if a state plan specifically linked the disparities to experiences of discrimination. So for example, a state saying something like American Indian youth have this specific experience in these numbers because of XYZ. So things like that, like a recognition of why that's happening. So our first example And moving on, in a couple of slides, we will have an opportunity for you all to review some examples and suggest improvements. So I'll try to quickly move through these 3 slides. I want to walk through an example of each of the different populations that we are focusing on today. We'll start with an example from Alaska that I think does a nice job of a couple of things. First, they call out the historical trauma in addition to individual experiences of trauma. This is huge because it sets a tone for recognizing that experiences of discrimination are not just interpersonal, but also intergenerational and institutional. It also provides critical context for understanding risk for Alaska Native communities. But this isn't just a one-sided portrayal of Alaska Native communities. This text also highlights the strength and resilience within Alaska Native communities, and even mentions that the suicide rate for Alaska Native elders is lowering than the national average. Next slide, please. Next, we'll take a look at an example from Colorado that focuses on LGBTQ youth. You can see that they outline some of the disparities that exist, but then they explicitly state that these disparities persist as a result of discrimination, stigma, and bias. They are not leaving any room for anyone to think that these differences might be due to LGBTQ youth being somehow more vulnerable, but rather they are linking these disparities with experiences of discrimination. Finally, they specifically call out the importance of school connectedness, in addition to peer and community connectedness. And finally, next slide. I want to point out that this example should be strengthened, but it is one of the few mentions in state plans for the role of discrimination in suicide risk for individuals with disabilities. We've included it here in part because they do call out depression, cognitive disability, and substance use carrying stigma. However, I'd be curious to see if anyone could think of a sentence or two that you could add here that would strengthen their strategies and the link between discrimination and suicide risk for individuals with disabilities. Now I will turn it back to Brandon while you all brainstorm.
Okay, so lesson learned, I should not be using my standing desk near the power strip, but now I can see everybody again. So while you all are, if you have a thought about this particular example, feel free to pop it in the chat, but we are about to move on to 2 other opportunities for us to also make some improvements and identify what is working. So if you have something related to this one, make sure to pop it in because we are about to go to the next slide. And I am going to ask you to think about what you like about the next slide and what you would improve about the next slide. So let's move on to the next slide. So I'm just going to read this out. And I want you all to be thinking, again, are there things in here that you like, that seem to be doing a good job? And are there areas for improvement? So this particular plan said lesbian, gay, bisexual, transgender, queer, and questioning people may be at increased risk for suicide. Currently, it's difficult to evaluate risk for suicide among LGBTQ people because sexual orientation and gender identity are not reported in death records. Self-report surveys of suicidal behavior are the primary source of data. Rejection of sexual orientation and gender identity by family and caregivers may significantly increase risk for suicide among LGBT youth, highlighting the need to include family-based interventions in suicide prevention efforts. So, hopefully folks are kind of identifying some things that they might like about this one or something that you would suggest get added to make it better. I'm just going to give a couple of seconds for folks' wheels to turn and fingers to type, and then I'll say something that I like about it. Okay, so while y'all are typing, which I'm sure you're doing, I will say something that I like about this one is that they actually call out the lack of data. So they do say currently it's difficult to evaluate risk for suicide among LGBTQ people because sexual orientation and gender identity are not reported in death records. And I personally think it's super important to call out the gaps in data because if we don't call them out, they're likely not going to get addressed. And I know there are people who want to address these gaps, so we just need to kind of help folks to know that, it's important and we care about it. Anybody else have a thought on something they liked? So I see Lori saying, I like people thinking deeply about where data come from. So kind of along the lines of what I was sharing. Beverly says the consideration of family-based interventions, which is great because I think sometimes we also leave out families when we're thinking about LGBTQ youth, and we think they're just not going to be supportive and they're not going to get there. So we just need to surround them with other supports. So this idea that we do also need to think about family-based interventions. So I see a bunch of ideas coming in, keep them coming, but I am going to move us on to the next example. So we're going to go to the next slide and see what folks think about this one. Again, feel free to pop in what you like about it or what you would improve about it. So I'll just read it out. American Indian and Alaska Native youth and young adults have the highest rate of suicide of any cultural or ethnic group in the United States. Suicide is the second leading cause of death for American Indian and Alaska Native children and adults ages 10 to 34. A recent study found that African American children ages 5 to 12, both boys and girls, are dying by suicide at twice the rate compared to white children. Racial and ethnic differences also are found among suicidal behavior. Latina adolescents in particular report the highest rates of suicidal behavior of any youth group. As many as 1 in 7 Latina youth attempt suicide, a rate greater than any other youth group of the same age. So, what you like about it, what you would improve about it. I'm going to give a couple of seconds for folks to ponder on it. I love how many people shared their thoughts on the last one. I will just say I definitely see room for improvement on this one. Okay, Sarah says, need to be explicit about why disparities exist. Exactly. They list a whole bunch of them and they're compelling and important. But what are we to think about these groups? Do we think that there are things going on outside of their control related to discrimination and stigma? Or do we think they just need some individual support because they just need some coping skills and then they'll be, feeling better? So Emma says, this reads mostly as a due to these folks being from X background, they experience suicide at these rates, rather than due to discrimination and lack of access to resources. So I like where we're headed. I will suggest to you all that if you haven't taken a look at your state plan, you might want to go and do that. I will also say, based on the website where we pulled these all down from, which is the Suicide Prevention Resource Center, several states have out-of-date plans. So now is the time to, if you're going to re-up it anyway, because it's outdated, let's get some better language in there and help people make these connections. So we're going to go on to the next slide, which is the final dot in our connecting of dots. And this dot is safe and supportive schools. So hopefully folks' wheels have already been turning about how this all applies to what happens in schools. I think particularly some of those pieces about pronouns and bathrooms are kind of clear examples that we've probably heard in the news recently. You may have also heard of some other things in the news recently about various bills that have been put up in state legislatures. So just want people to keep all of this context in mind as we're thinking about what is happening for youth right now. So let us move on to the next slide. And what I want to focus on here really is to emphasize that research suggests that school connectedness is a protective factor for reducing suicide risk. You can see a couple of articles that are listed at the bottom as sources, and they are actually review articles, so they have looked at several different studies themselves. And what we know is from the research that have been summarized in these couple of studies is that school connectedness is protective for all students, but several of these studies found that it's particularly powerful for LGBTQ youth. Now we have limited time today, so I won't be able to go into everything I would love to say about school connectedness, but we're going to pop up a link to a resource page that the CDC Division of Adolescent and School Health maintains on school connectedness, because it does have some resources, some summaries of research, as well as practical strategies for schools. So take a look at that, and we are going to move on to the next slide. So while school connectedness is protective, as we just saw, it's important to recognize that many groups of youth, in particular the groups that are most at risk for suicide, also are the groups that report lower levels of school connectedness. This is especially true for youth with multiple marginalized identities. So for example, on this slide, you can see the findings from a recent study that found that youth of color in their study tended to report lower levels of school connectedness than their white peers. And additionally, they found that across all racial groups, students with disabilities who also identified as LGBTQ reported the lowest levels of school connectedness. So this is kind of a similar pattern to what we've already heard from Dr. Price, that having multiple marginalized identities puts youth at additional risk. And so because youth don't just live in one category of their identities, as we're thinking about suicide prevention, we really need to think about the multiple identities and the multiple forms of discrimination that youth might be experiencing. Next slide. So one of the things we know from the data is that youth with marginalized identities, again, especially youth with multiple marginalized identities, tend to report higher levels of victimization and are also more likely to report suicidal thoughts. So in our remaining time, we're going to talk about what can be done in schools to address victimization in order to reduce suicide risk. Next slide. And we're going to start with our good old YRBS data. So on the left, you'll see the data from 2019, which is the most recent data we have. And this is a question on being bullied on school property in the past 12 months. And you can see that LGB students, almost twice the percentage of LGB students reported being bullied on school property compared to their straight peers. And then going back to that 2017 data that we also talked about earlier, we can also take a look at different experiences for cisgender and transgender youth. And you can see, again, it's similar to what we saw on the other slide in terms of suicide attempts, that the experiences of being bullied on school property are much higher for transgender youth than for cisgender females or cisgender males. Cisgender females do report, there's a slightly higher percentage of cisgender females reporting being bullied on school property. But again, transgender youth have a much higher percentage. Next slide. So now that we've seen the important role that schools can play in establishing safe and supportive environments that also reduce the risk of suicide, we'll review a couple of policies and practices that schools can consider implementing and that education and health leaders in both state, federal, local level, everybody can consider supporting these. So the first one is enumerated anti-bullying policies. So as you can see on the slide here, explicitly naming protected groups is linked with reductions in victimization. And in specific, there's evidence that when these policies specifically name LGBTQ youth as a protected group, that LGBTQ youth in those schools tend to report lower levels of victimization. And it doesn't work as well when they are not specifically named. So it is important. That's what the enumerated part is it needs to be called out, and not just those general anti-bullying policies, but being specific about the protected groups does make a difference. Next slide. So we will see here some data from, I think this is current as of February of last year. So changes may have happened in the past year and they're not reflected here. And our friends at NASB can pop in if you have any additional kind of context for this, because this actually comes from NASB's school health policy database, which I encourage everyone to visit. You can see the link at the bottom of this image. But in particular, I want to draw your attention to the green, the darker green squares with the stars. And those are states that, again, as of February of last year, had enumerated protected groups in their policies, including explicit protections for LGBTQ youth. And if you go to the website for the database, you'll actually be able to click on things and read what the actual policy says. So if you're interested to learn more, if you're surprised by what color your state is, you can look them up. So let's move on to the next slide. So I mentioned at the beginning of the webinar that LEAHP, the project that this webinar is being housed under, focuses on 3 domains for advancing adolescent health in schools: sexual health education, sexual health services, and safe and supportive environments. On this slide, you can see that there is some intersection between those domains, because there's evidence that both gender and sexuality alliances, or GSAs, they also used to be, or kind of sometimes still are, called gay straight alliances. But those, as well as LGBTQ inclusive sexual health education in schools, have been shown to be protective against suicide for all students, and especially for LGBTQ youth. And I think, again, this is one of those, it's a theme that when the things that are good for LGBTQ youth, like inclusive sex ed or like GSAs, are actually helpful for the school community and the school culture as a whole, and will help to improve connectedness to school, because it will be a better place for everyone. So let's take a look at how states are doing. And on the next 2 slides, we'll see some data. It might be a little hard to look at. If it is, we can pop in the link. These are a couple of pieces that we did earlier based on CDC school health profiles data, where you can see all the states that are blue reported an increase in the percentage of secondary schools that have LGBTQ inclusive sex ed materials. So it's not necessarily a curriculum, but they reported that they have LGBTQ inclusive sex ed materials. And the line is because for most or many states, we have 2 years of data. We have data from 2016 and data from 2018. So the slope of the line shows you how much it changed. If the state has blue, that means it went up. If the state is in orange, that means that the percentage of secondary schools reporting that they had LGBTQ inclusive sex ed materials went down. And if it's gray, if it's the whole box is gray, we just didn't have the data. But there's a couple of states that have a gray line, and that's because they just didn't change much. But you can take a look. The link is in the chat if you want to look at more. Also, you can take a look at the CDC school health profiles data for your state and see what's going on there. And we're going to go to the next slide, which is similar in its setup, but this one focuses on the percentage of secondary schools that say they have a GSA. And again, the states with the line in blue is because they increased from 2016 to 2018. Orange is where it went down. It was just a couple of states that went down. So we're happy to see, for the most part, things were going up. And then the dark blue squares are the jurisdictions where at least half of the secondary schools in that state, or I think DC is one of them too. So I got to give a shout out to DC since I live here. That DC is included in this number, where at least half of secondary schools reported having a GSA. Okay, so we covered a lot of information about some of the policies and practices that we know make a difference for LGBTQ youth. They make a difference in terms of creating more positive environments for all students, and they also make a difference in terms of reducing the risk for suicide. So with that, we are going to move through just a couple more slides. I'm going to be sort of quick on these, but these are some federal funding opportunities that are coming up. So this first one is from the CDC, and it's the expansion of comprehensive suicide prevention across the US. That one, actually, I think folks might need to click on that one because last I saw it was still a forecast, but check it out. Next slide. One of the other opportunities that's coming out of SAMHSA is Project Aware. So I don't know how familiar folks are with Project Aware, but it is a project that focuses on mental health in schools. So this is an opportunity folks can take a look that focuses on mental health supports in schools. Next slide was another one I thought was interesting. This one comes out of HHS Office of the Assistant Secretary for Health, and it is demonstrating policy effectiveness to promote Black youth mental health. So that one is specific to Black youth, and it also focuses on policy. And then the next one is Garrett Lee Smith funding, which funds a lot of suicide prevention work in states. These two opportunities are specific to tribal youth and to post-secondary campuses. So we ended with a couple of minutes to spare. I know we do have an evaluation that we will ask you all to complete, but if anybody has a burning question that you want to ask while we have the presenters here, we do have a few moments to answer a question or two. And I want to point out that Megan from NASB helped correct me that the database is current as of September 2019. I see somebody also asking if anybody has a resource that lists best practice for safe and supportive schools. We will, if folks have resources that you are aware of, it would be great to drop those in the chat because you have a bunch of colleagues here who I'm sure would love to use things that other people have already found useful. We'll be happy to compile them if you drop them in here and send it out. And we can also, we'll take a look once this is over and see some of the questions and see if there's anything that we can answer when we send out the follow-up to folks. Okay, so let's see, did anybody pop a question in that we, nope, the people are popping in resources, that's fantastic. It takes a village, so everybody sharing. Again, I always like to hear not just a list of resources, but resources that I know other people find useful. You should also see the evaluation poll has popped up for you. So please just let us know what you thought of the webinar before you leave us. We appreciate your time. We appreciate the good work that everybody is doing. And as Megan pointed out, definitely check out the website for LEAHP to learn more. We're happy to answer any questions, connect folks. But thanks again for attending and keep an eye out for other things we'll be doing. Check out the website. And keep those resources coming. All right, have a great rest of your week, everyone.